Hello, 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 Facebook. I'm Dr. Myla Bennett of Adarabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. And I'm coming on, this was not a planned Facebook Live. As you see, I'm sitting in my car. But I had just come out of Target, and I was talking to one of my friends on the phone before I pulled out the parking lot, and I'm scrolling through my timeline on Facebook, and one of the surgery groups I'm in, a lady posted and announced that her goddaughter just passed away from getting liposuction in Juarez, Chihuahua. It's a place in Mexico. And the only thing that she mentioned is that her goddaughter had traveled there and didn't tell anyone in her family. So her family basically found out she went for surgery when they found out that she passed. And all they know is that she just didn't wake up. So I was reading through the comments, trying to see what happened, see if, she mentioned anywhere what happened. And reading some of the comments got me upset even more. One person wrote that they were considering getting surgery. They were about to get surgery somewhere else also. And when I say somewhere else, I mean anywhere that's not your home city. So this is not about countries or anything, because people die everywhere. We have hot mess doctors in the United States, hot mess doctors outside of the United States, good doctors in the U.S., good doctors outside of the U.S. This is not a turf war thing. This is back to ethics and back to people, women, taking more responsibility for themselves, and not everybody just trying to blame the doctor. The doctor is, a lot of times some of these doctors are wrong too. But sometimes if you are walking into a situation where a particular place or a particular surgeon, or sometimes they're not surgeons, has a track record of killing people, then it's my opinion that if you know a doctor regularly has people dying under their hands when they do plastic surgery, perhaps you shouldn't go there. So I was bothered because I saw someone else say that they were planning to go somewhere for surgery and they got a life insurance policy just in case. Now, I'm not saying don't get life insurance policies. You should have those types of things in place whether you get surgery or not. But the undertone in that, and what really got me upset and stirred, is that she was preparing in case she died, which means she was okay with dying for liposuction, which makes no sense to me. Like, I don't understand that. I have 3 children, and I couldn't imagine if I saw... I'm not scared of liposuction because I know that there's plenty of doctors who do liposuction every day who don't have any deaths, and that's who I'm going to go to when I get some lipo. I'm not going to go to a place where they have a track record of killing people. I would never do that because I need to live for my kids. So I'm not saying nobody should get plastic surgery. I do plastic surgery. I think cosmetic plastic surgery is safe when you go to safe doctors. The people who have deaths tend to be the same people having deaths over and over again. So people were trying to figure out why she died, and that was my question too, trying to get any type of insight into what may have happened. And I saw a lot of people saying, once the lady said they don't know, all they know is that she just never woke up. So then people were saying, oh, maybe she had too much anesthesia. Well, the only way that actually is really an issue is if the person doesn't have a breathing tube put down, like if they're not put on a ventilator. That's kind of like how Michael Jackson died. He was getting anesthesia without being put on a ventilator. Well, usually when somebody is getting put to sleep, they're on a ventilator. So if she was on a ventilator, you really don't get people dying from too much anesthesia. Like, it doesn't really work like that. You wake up, and if you don't, you're hooked up to the machines that will breathe for you until the anesthesia wears off, and you still will wake up. So it's not likely that it was that. The only way it could have been that is if they didn't put a breathing tube down, and which is not really being put to sleep. That's sedation. That's called conscious sedation. So, but I don't know if she had that because I don't know what they did. But 9 times out of 10, I'm assuming she probably was put all the way to sleep. She probably had a breathing tube down. And if she was getting liposuction, one of the things that's really popular now is aggressive liposuction. So she could have lost too much blood. She could have had an injury to a organ, like one of her organs, if the liposuction cannula went somewhere that it wasn't supposed to go. I don't know the skill level of the person she was going to. I don't know if the person she was going to was actually who ended up doing her operation. Sometimes places where they have really, really high volume, you'll go to sleep thinking that one person is doing your surgery, and turns out somebody else is doing your surgery. And a lot of times that somebody else is a person who isn't a doctor and who is not qualified to be operating on people. And so that's when you tend to get those types of injuries to the viscera or the organs. Something like that could have happened. It could have been a fat embolism if she was getting a Brazilian butt lift. It probably wasn't a PE. Usually PEs don't happen on the table. They usually happen after surgery. But I guess technically it could have, but usually they happen after surgery. So if it was any type of embolism, it could have been a fat embolism. She could have had cardiac arrest from, like if she, well, a fat embolism can cause cardiac arrest. Losing too much blood can do that. It's a lot of reasons why she could have lost her life. I'm not sure. I don't know anything about the situation other than she didn't wake up. But the reason I decided to get on here was to talk about loving yourself, like having unconditional, undying love for yourself, because then I think people would be a lot more discriminating against who they allow to operate on them if they had more love for themselves. I think if you knowingly go somewhere with a track record, which I honestly, you know what? I actually don't know if this place had a track record because I don't know who she went to. They didn't tell us that. They just told us the city. But usually every time I keep hearing about people dying, I just heard about somebody dying last week. Another girl died last week. I don't get on every time somebody dies because I would be on here every week saying the same thing, you know. But usually when it's deaths, it's from the same people. Like, it's the same people. And my thing is, if you really love yourself, you wouldn't lay down at the hands of a person who kills people on a regular basis. You wouldn't be that desperate to change your body that you will be willing to die for it. Like, I just can't wrap my head around it. And I just feel bad. It was Juarez, Chihuahua, Mexico. I just feel bad for what people have to be going through. And a lot of times people don't even realize that they don't even realize that they have an issue. You know, they just get this desperation inside that they have to get this surgery. I gotta get my surgery. You know, and they rationalize and say, well, that's a risk of surgery. And what you should be saying is, if that's a risk of surgery, if death is a common risk of surgery, I don't want it. I will keep these love handles. I will keep my SpongeBob SquarePants body. That's people keep saying that. I don't think these ladies be looking like SpongeBob at all. But people have gotten so used to this exaggerated frame that they think everything is SpongeBob. But let's say you were built like SpongeBob. I'd rather be alive and built like SpongeBob than dead with a snatched up waist. Or dead with a BBL. Are they going to lay you face down in your casket so everybody can see your butt? Like, it doesn't make any sense. If you feel like you're if you are obsessing over your surgery, if all you do is look at before and after pictures and compare other people's results and you're talking about your surgery all the time, you should stop for a second and try to figure out if you are obsessed and have a deeper issue that needs to be dealt with. And if you have a surgeon that you know has had people die, and more than one death, then you need to pick another surgeon, and you need to be asking yourself, why am I willing to go here if he keeps killing people? Like, what's wrong with you in your mind when you have rationalized that that's okay? The doctors, I said this before, the surgeons that trained me, they didn't have deaths from cosmetic surgery. I haven't had any deaths doing cosmetic surgery. Yeah, it happened in Miami. Somebody died in Miami last week, and I have had two. That's why I said it's not a country thing. This is not about U.S. versus somewhere else, you know. But I've had two people in the last 3 days call me about someone they know who had surgery in Miami, who had issues, bad ones, ended up in the ICU and, you know, and stuff. When they got back home, ended up in the ICU, like, in the last 3 days. And then somebody just called me this morning about another person who had surgery. I think it was in Florida, but it wasn't Miami. But she didn't get put in the ICU, but she ended up in the hospital 2 days getting blood transfusions because she passed out. Like, this is not normal stuff. Like, I don't, it's just, it's not normal. No, the whole Miami's not bad for surgery. No. It's just the bad places are bad for surgery, and y'all know which ones are the bad places. It's complication capital because they have some of the same unethical stuff going on that is going on with some of those doctors who have in other countries that have high death rates and high complication rates. It's not the location, it's the ethics of the doctor and the desperation of the women who go to those people. You know, it's like, I just don't know. Yes, you have to love yourself. And, you know, if it's something you want to modify and you can do it in a safe way, do it. But here's the other thing that bothered me and why I decided to sit in my car in the Target parking lot. See, I'm at Target, y'all. I'm like, let me do this before I go home while it's fresh on my heart. People traveling away from home, anywhere. I don't care where you're going. It doesn't matter what country it is. If you're leaving home to go somewhere, but especially if you're leaving the country, because it gets complicated. If you're leaving the country to go somewhere, or leaving home to go get surgery, tell someone. Make sure someone knows. Make sure at least one person knows that you're gone. Like, so this person, no one knew, and then now they're trying to get her back home, and they can't. She's stuck over there. Her body is stuck over there. Okay, Nisha Wheeler, you said, and like I said in another video, some are doctors but not cosmetic surgeons. Okay, so you misunderstood my video. So some of them are doctors but not plastic surgeons. So a lot of the doctors who do plastic surgery and aren't real plastic surgeons, they call themselves cosmetic surgeons. Plastic surgeons call themselves plastic surgeons. Patients hear the same thing. And in fact, some of these unethical people are so conniving that they actually will make you think they're more qualified than a real plastic surgeon to do your surgery because they're a cosmetic surgeon. That's not a real recognized specialty by doctors. It's fake. Cosmetic surgeon is not what you should be looking for. You should be looking for a plastic surgeon that does cosmetic surgery. But plastic surgeons tend to not call themselves cosmetic surgeons. Usually if somebody's calling themselves a cosmetic physician or a cosmetic surgeon, they're probably not a plastic surgeon. Right, and so they do it for the price. They go to different sketchy places because of the price, but it's not always just the price. They also go to some of these sketchy places because of the aggressive, exaggerated body types that they make, which to each her own. If you want to look like that, that's not, I don't care about that part because that's not going to kill you. But go to a person who can make you look like that without killing you. No, they won't go to jail for lying. Nope. It's not really a lie. That's what they classify themselves as. And if you let them do it, that, you know, a medical license is an unrestricted license. A doctor can do anything on a person's body for as long as the person signs a consent form for it. So it's up to you to make sure that you're going to somebody who actually had training in it. Real training, not a weekend course, not a week course. My plastic surgery training took 6 years. It's called a residency and a fellowship. And then if they tell you, oh yeah, I did a cosmetic surgery fellowship. If they did it under another doctor who's not a plastic surgeon, then they may as well not have had a fellowship. It's bullcrap. That's why you need to make sure it's a plastic surgeon. Yes. They won't go to jail for lying. No. It's not really a lie. Like, that's what they call themselves, cosmetic surgeons. They do cosmetic surgery on people. They're not supposed to, but they are. So it's up to you to not be desperate. It's up to you to pay attention. If you see people who went to that doctor and they have big black abdomens after they died or got liposuction burns or necrosis, and they had this person die last week, don't go there. Don't go. It's not that serious. Hold on, I'm trying to get, okay, my comments froze up. It's usually, okay, the girl was probably healthy enough. Like, everybody, you know, like, she was probably healthy enough. I bet you it was over-aggressive surgery, or she was getting a Brazilian butt lift and got a fat embolism. It's usually those two things. It's usually losing too much blood or a fat embolism. Those are the two things that usually kill people from cosmetic surgery. That's why I hate those Brazilian butt lifts. Like, I hate that surgery. I hate it. And the American Society of Plastic Surgeons has issued like a statement saying that we should not be injecting fat into the muscle because it is too dangerous. And they just did that last week. Hopefully that guy wasn't doing that, but hey, he's not in the United States. He can do whatever he wants, I suppose, but it's up to you. 1 out of 3,000, yep, died from a BBL. Like, it's just a ridiculous statistic. It's ridiculous. And it feels like more than that. As much as I hear somebody dying, I swear to God, every week I hear about somebody dying. Like, literally every week. It's ridiculous. I'm just looking at comments. Oh God, yep. See, BBL, it was a fat embolism. It was 9 times out of 10 it was a fat embolism. So now her husband is a widower and her baby has no mother. Hi, Sabrina. Natasha, DM me your email address and phone number, and I'll have somebody call you this weekend. Yep, Matt, Kimberly Smith, someone died. Someone just died. A fat embolism is when a globule, a big chunk of fat gets into your veins, gets in one of your big veins, and goes up to your lungs and blocks stuff off. And then people usually die suddenly with that. It makes it so that you can't oxygenate, and then your heart will, like, sometimes you'll end up, the person will go into cardiac arrest right after the embolism clogs up their lungs, and they die. It only happens with Brazilian butt lifts. Sabrina, you saw 2 different posts about 2 different deaths? K. Michelle's issue, she had fat, no, not fat, she had injections of, like, I think free silicone into her butt and this stuff, and it caused issues. And then the surgery she got was to remove the stuff, and whenever you remove that stuff, that can kill you trying to remove it. So she had a lot of problems because that's really dangerous to remove that stuff. that every day I just try to work out, but God, oh, I can't see it, but God, I'm sorry, Tiffany, I can't see your whole comment. Keandra, you're welcome. And okay, so that's one of my other pet peeves, Keandra. So you say, I just want people to think about it different. So you said, thank you for explaining that, and you're very welcome. That's what I'm here for, to help. Some dolls don't understand what an embolism is. Thank you. I don't like that people call themselves dolls, because I think that is part of the problem. So like, this is why people are trying to do this exaggerated stuff, because they're thinking of themselves like a doll, and you're not. You're a woman. Like, it has a soul. A doll doesn't have a soul. A doll can't get killed in surgery because she never was alive in the first place. That is part of the reason why people are embracing this fake look, this manufactured look. You're not a doll. You're a woman with a family, a lot of times children, a soul, a heartbeat, and so I think that this whole culture that has been created in the last few years it's dangerous, and it's bad, and it's making women, it's dehumanizing women. Yeah, you're a woman. You're not a doll. Neither. And that lady who died, she was not a doll. She was somebody's mother and somebody's wife. She was a human, female. She was a woman. People need to stop thinking about themselves like dolls, because you're not a doll. You're a lady, a woman with a heartbeat. Butt implants are, they don't kill you, but they do have a high complication rate. So I don't really do those either. I don't do those either. I just really ain't down with the butts. Oh my gosh, 2 different deaths. I didn't even hear about the second one. I didn't scroll long enough. As soon as I start scrolling, that bust me in my eyes, and then I got caught up in the comments, and then I got all upset, and then I pushed live on Facebook. So I guess when I get off, I'll see the other one. Yes, it's not a doll. You're a woman. Yeah, I hate the doll thing. Like, I don't ever want to see Bennett dolls anywhere, nowhere. Please don't call my patients dolls, because they are women. And it's too heavy on one side, and she's having issues. She has a huge butt and chicken legs. At least she's alive. I'm so grateful for... Oh, thank you. You're welcome. Shamika, somebody died. Somebody passed away today. In Mexico, getting surgery, and her family can't get her back. She didn't tell anybody she was going, and they found out she went when they called and told them that she died and didn't wake up on the table. So I'm all upset. I'm pretty good, Shamika. How are you? My Facebook is tripping. I'm trying to scroll through the comments. The fat embolism usually occurs during surgery. I don't know her name. They didn't say her name. Yeah, I care about my patients and everybody else's. I just don't want people to die. I don't want everybody to come to me, because if you want a BBL, I'm probably going to talk you out of it. I do them every blue moon. I did one right after Myla was born. And I did one like last year. But your butt has to literally be like a pancake, and I have to have nothing to contour for me to be like, all right, fine. I just don't love that surgery. I'm doing one next month. But I don't inject into the muscle. I won't inject into the muscle. So if somebody's trying to be really, really big, that's why I don't, but that's why doctors inject into the muscle, is because more of the fat will survive that way. And if somebody's trying to be really, really big, then they don't need to come to me, because I'm not going to inject anything in anybody's muscle. So, you're welcome, everybody. All right, I guess that's all I have to say about that. Just be careful, and I want everybody to stop for a moment and say, why am I getting surgery? And you shouldn't be getting it to, they gonna be mad when I get my BBL. you know, that type of, if it's that type of mentality, or if all you're secretly thinking about is when you get to take your waist selfie to show everybody your snatched waistline, or so you can take your picture in the car like this and show everybody that your waist is small, that's not a reason to do it. It's not a reason. Like, you shouldn't be doing it because somebody cheated on you and you think that if you had a big butt, he wouldn't, or he gonna be jealous when your butt gets big. Like, those aren't reasons. And if you find that you're obsessing over it, so like on your free time when you're at work, like, you know, all the time you're in these groups looking at pictures, talking, counting down, you done set up whole pages just to talk about surgery, that's kind of abnormal. You should be thinking about what's going on, why you're so obsessed with it. Because those are the people who end up in situations that will hurt them when they get desperate. So I'm gonna go ahead and leave this parking lot. I'm going out of town this weekend, and I gotta get some stuff done before the next hour, before the girl who's braiding my hair gets to my house. So I gotta go. But I just wanted to say that I want everybody to be careful. Condolences to the family of the lady who lost her life today, and I hope they are able to get her back home so that they can pay their respects. And I just hope none of you put yourselves in a situation to be hurt. And even if you put a deposit down with somebody, I don't care if you paid in full and you can't get your money back. If they got people dying, please don't go. Chalk it. Like, well, I spent my money already. I don't know. I don't care if you spent $15,000 and you realize the person got somebody dying every month. Just, you're worth more than $15,000. So, anyway, I'm out of here. I will probably not go live again until after I get to my guess where I'm going. I'm going to the Dominican Republic to vacation. It's good for that. I'm going to Punta Cana. So I will probably go live from the white sandy beaches of the Dominican Republic. It'll be my first time going there. I'm looking forward to it. So anyway, I will see y'all on the beach. Alrighty, bye-bye. Oh, I'm Dr. Myla Bennett of Aderabella Plastic Surgery and Medical Spa in Johns Creek, Georgia. And you can reach me on my website at www.aderabella.com, or you can call my office at 678-325-0006. Alrighty, bye.